Subscribe to our channel by clicking the subscribe button. Click the bell button and enjoy the latest uploads from our channel.
Diabetes.
According to new report of Centers for Disease Control and Prevention, CDC.
More than 100 million U.S. adults are now living with diabetes or prediabetes. The report finds that as of 2015, 30.3 million Americans, 9.4% of the U.S. population have diabetes. Another 84.1 million have prediabetes, a condition that if not treated often leads to type 2 diabetes within 5 years. So, what is diabetes? Diabetes is a disease in which your blood glucose, or blood sugar, levels are too high. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. There are mainly two types of diabetes: type 1, type 2. Human blood sugar levels are Type 1. It is also called insulin-dependent diabetes. It used to be called juvenile onset diabetes, because it often begins in childhood. Type 1 diabetes is an autoimmune condition. It's caused by the body attacking its own pancreas with antibodies. In people with type 1 diabetes, the damaged pancreas doesn't make insulin. Type 1 diabetes may be caused by a genetic predisposition. It could also be the result of faulty beta cells in the pancreas that normally produce insulin. Diabetes type 2, by far, the most common form of diabetes is type 2 diabetes, accounting for 95% of diabetes cases in adults. Some 26 million American adults have been diagnosed with the disease. Type 2 diabetes used to be called adult onset diabetes, but with the epidemic of obese and overweight kids, more teenagers are now developing type 2 diabetes. Type 2 diabetes was also called non-insulin dependent diabetes. Type 2 diabetes is often a milder form of diabetes than type 1. Nevertheless, type 2 diabetes can still cause major health complications, particularly in the smallest blood vessels in the body that nourish the kidneys, nerves, and eyes. With type 2 diabetes, the pancreas usually produces some insulin, but either the amount produced is not enough for the body's needs, or the body cells are resistant to it. Insulin resistance, or lack of sensitivity to insulin, happens primarily in fat, liver, and muscle cells. People who are obese, more than 20% over their ideal body weight for their height, are at particularly high risk of developing type 2 diabetes and its related medical problems. Signs and symptoms: frequent urination, excessive thirst, increased hunger, weight loss, tiredness, lack of interest and concentration, numbness in hands or feet, blurred vision, frequent infections, slow healing of wounds. Foods and things beneficial in diabetes: healthy carbohydrates. During digestion, sugars, simple carbohydrates, and starches, complex carbohydrates, break down into blood glucose. Focus on healthy carbohydrates, such as fruits, vegetables, whole grains, legumes, such as beans and peas, low-fat dairy products, such as milk and cheese. Avoid less healthy carbohydrates, such as foods or drinks with added fats, sugars and sodium. Fiber-rich foods. Dietary fiber includes all parts of plant foods that your body can digest or absorb. Fiber moderates how your body digests and helps control blood sugar levels. Foods high in fiber include vegetables, fruits, nuts, legumes, such as beans and peas, whole grains. Heart-healthy fish. Eat heart-healthy fish at least twice a week. Fish such as salmon, Mackerel, tuna and sardines are rich in omega-3 fatty acids, which may prevent heart disease. Avoid fried fish and fish with high levels of mercury, such as king mackerel. Good fats. Foods containing monounsaturated and polyunsaturated fats can help lower your cholesterol levels. These include avocados, nuts, canola, olive and peanut oils, but don't overdo it, as all fats are high in calories. Foods that must be avoided. Sugar-sweetened beverages. Sugary beverages are the worst drink choice for someone with diabetes. To begin with, they are very high in carbs, with a 12-ounce, 354 milliliter, can of soda providing 38 grams. In addition, they're loaded with fructose, which is strongly linked to insulin resistance and diabetes. Indeed, studies suggest that consuming sugar-sweetened beverages may increase the risk of diabetes-related conditions like fatty liver. Trans fats. Industrial trans fats are extremely unhealthy. They are created by adding hydrogen to unsaturated fatty acids in order to make them more stable. Trans fats are found in margarines, peanut butter, spreads, creamers and frozen dinners. In addition, food manufacturers often add them to crackers, muffins and other baked goods to help extend shelf life. Although trans fats don't directly raise blood sugar levels, they've been linked to increased inflammation, insulin resistance and belly fat, as well as lower good HDL cholesterol levels and impaired arterial function. Eating bread, bagels and other refined flour foods has been shown to significantly increase blood sugar levels in people with type 1 and type 2 diabetes. Plain yogurt can be a good option for people with diabetes. However, fruit-flavored varieties are a very different story. Flavored yogurts are typically made from non-fat or low-fat milk and loaded with carbs and sugar. Eating cereal is one of the worst ways to start your day if you have diabetes. Coffee has been linked to several health benefits, including a reduced risk of diabetes. However, flavored coffee drinks should be viewed as a liquid dessert, rather than a healthy beverage. People with diabetes often try to minimize their intake of white table sugar, as well as treats like candy, cookies and pie. When fruit is dried, the process results in a loss of water that leads to even higher concentrations of these nutrients. Unfortunately, its sugar content becomes more concentrated as well. Pretzels, crackers and other packaged foods aren't good snack choices. They're typically made with refined flour and provide few nutrients, although they have plenty of fast-digesting carbs that can rapidly raise blood sugar. Although fruit juice is often considered a healthy beverage, its effects on blood sugar are actually similar to those of sodas and other sugary drinks. This goes for unsweetened 100% fruit juice, as well as types that contain added sugar. In some cases, fruit juice is even higher in sugar and carbs than soda. French fries are a food to steer clear of, especially if you have diabetes. Potatoes themselves are relatively high in carbs. One medium potato with a skin on contains 37 grams of carbs, 4 of which come from fiber. However, once they've been peeled and fried in vegetable oil, potatoes may do more than spike your blood sugar.